patients are actually being referred to infertility centers? Very common?
Very common.
Very common.
Very common. In fact, the statistics, I think, say the incidence of any kind of infertility is about 17 to 18%. This is the quoted incidence. And so, what is infertility? Infertility is when a couple is not able to get pregnant after 1 year of unprotected intercourse. That is another problem that today, after 2 or 3 months, people come to us. It's like, ki pehle 4 5 years, I'm not going to do it. But the day I've decided next month, it better happens. Now, if this has not happened, I must go to the doctor. So that's also another problem. And if I tell people, no, you must wait, they say, no, doctor, I'm turning 35. I say, suddenly you've not turned 35. You would have thought about it before. So it's like people are having, a sword hanging on their heads that today I've turned 35. Now I better get pregnant. 1 month ho gaya, and now something has to be done. So
So it has to be 1 year.
1 year.
1 year of
The book
attempt.
says 1 year of unprotected intercourse in case the pregnancy doesn't happen.
Then you
Now
belong
is
to
the time to investigate. But people come to us much, much, much before that. 1 month, 2 months, and they are at the doctor's chamber.
doctor chamber.
It's okay, but nowadays we say post 35, you should not be waiting for very long because as it is, the ovarian reserve also comes down.
What is the ideal time to be pregnant according to you?
Ha ha ha. This is, if I say this, people will go into a shock.
As a gynecologist, what is the ideal time to get
Early 20s.
Early 20s.
Early 20s. That's when a girl gets pregnant easily, has an easy pregnancy, uncomplicated pregnancy with the most successful pregnancy outcomes. But today, because of various reasons, career and not being able to find the right partner, people are getting married beyond 30s. And then after that, you're waiting 3-4 years to plan a pregnancy. And then suddenly at 35, you wake, oh, I have turned 35.
Right.
So
The 35 is because pregnancy beyond 35 has an increased risk of complications, correct? Or not really?
number one is that chances of getting pregnant easily, that decreases. So we have proper statistics which say that age is one single most important variable when it comes to getting pregnant. So there's an exponential decline with rising age. So it's not 35, 34, 33, whatever. The age is one single important variable. And today we are seeing a very disturbing phenomena which is called premature ovarian failure. So women are losing their eggs faster. So there are so many times people come to us with a missed period and you get their pregnancy test done, it's negative. You get their AMH and FSH done, it's high. AMH is low and FSH is high. It's so disappointing.
At what age?
32, 33.
Oh my God.
I mean, I had a few days back a patient who was a VP in one of the corporates. She says, now I'm settled in my career and now I want to plan a pregnancy. And she came to us with a missed period. We did a pregnancy test. It was negative. We did the complete hormonal profile and we found out that AMH was just 0.1, which is like
Almost a
practically
failure.
almost. This is known as premature ovarian
failure.
Or we don't like to use the word failure. We say as doctors, ovarian insufficiency.
Insufficiency. Yeah, exactly.
So,
Insufficiency.
yeah. So, number one, ovarian reserve is a genetic,
Can you tell us about the ovarian reserve?
Okay. So every girl child is born with fixed number of eggs in her ovary. Now this is controlled genetically. That's why in olden times the age of menopause was decided by, for example, if your mother had an early menopause, probably you will also have an early menopause. If your mother had late, you probably also will have a late menopause. Now when a girl child is born, she probably has millions of eggs in her ovary. But then slowly, the eggs, they come down. By the time she has her puberty, probably the eggs in her ovary are only 3 lakhs. For millions, it comes like that. And when she is, planning her pregnancy by about 25 or whatever, the eggs probably could have been just 40,000 or 50,000. So the age causes, exponential decline. And
So for every
also,
year, there's decline in the ovum.
every month, if there's one egg ovulating, there are 10 eggs which are developing at the same time, but out of that, only one lucky egg develops and ovulates. So there's a lot of egg wastage which happens every cycle. And nowadays, because of multiple environmental factors like pollution in the air, herbicides, pesticides, bad food, women are losing, smoking, alcohol, women are losing their eggs very fast. I mean, it's very common, very common. And that's why, these days we talk about egg freezing. We tell people that in case, because of whatever reason, you are planning to delay your pregnancy, at least go to the doctor. When you are in 25, you're 25 or 26, get your AMH test done, get your eggs frozen, so that later on, you may plan 35, 40, whatever. At least you have some backup.
Because the quality of the egg is much better.
Yes. So people generally ask, ma'am, when? Should I do it at 25? So the answer to that is earlier the better. Because earlier we get a better cohort of eggs, better
correct.
number, better quality.
And how long
So
can...
this is the new gynecology. Like I was telling you, in olden times, we never faced this problem. Infertility, premature ovarian insufficiency was not there.
So as the... I'm just going to summarize what you said. As the age advances, the number of ovarian follicles can also go down. Number of ovum goes down. So you're saying that earlier, the better chance of pregnancy. Chance of pregnancy. But if you're delaying because of your career growth or any other reasons, they call it as cryopreservation? Or what do they...
Yeah, so it's called oocyte freezing.
Oocyte freezing.
Yeah,
Oocyte is the
oocyte
ovum.
freezing is more technical, but egg freezing is
Egg freezing.
a common laymanish.
Huh.
Nowadays, we also do what is known as embryo freezing. So in case you know that this is the partner, and as a couple, you want to delay your pregnancy, then you can get your embryo frozen. And embryo frozen, pregnancy after frozen embryos is much better than oocyte freezing, because many oocytes might not get fertilized. So here you've already made the embryo and frozen it. So that carries better pregnancy rates.
As the years advance, is the prognosis of that embryo turning into a successful pregnancy? What is the prognosis? Is it good?
Not really. The eggs and the embryo can be stored till infinity. Till
Wow.
infinity. So that's what is the future artificial reproductive technology. And it has its own ethical and emotional dilemmas. God forbid the parents are not there and the embryo is still alive.
Right.
So a lot of legal and ethical and emotional problems are there. So
So the frozen embryos can survive until infinity. But let's say we unfreeze it, we thaw it, and then
yeah,
implant
there
it.
is always a wastage. When you thaw them, in case there's any problem in the thawing, or even a minor variation here and there, it can
That's what I was
spoil
trying-
the embryos.
Huh.
But we assume that the IVF centers
Or
are
doing a good job.
good job.
Good job. Huh. So the successful pregnancy is definitely a possibility.
Absolutely, absolutely.
You have seen
So
success.
people do go for, the couples nowadays go for the embryo freezing, and
I'm going to ask you a very practical question. These are all new, right? New techniques. How do we know the increased risk of, chromosomal abnormality?
Yeah. So whatever the data says till now, whatever babies have been born through the FET, which is the frozen embryo transfer, we've not seen any statistical difference in the chromosomal or any kind of birth anomalies in these babies. But like you rightly said, time will tell a
Time
lot
will
of
tell.
things.
Because it's all new.
Yeah, it's all new. But
so far the data is
yeah,
good.
so far the data seems very promising. So I always tell this to patients that in case you are planning your pregnancy to be little later, at least go to the doctor, discuss your options, and see where do you stand today. For example, if your AMH today is very low and you are just 27 or 28, better go for egg freezing quickly. In case your AMH is still okay, you can still take some time.
AMH is a testing that they can come and check with you.
Yes. So AMH is a very simple blood test. It's called anti-Mullerian hormone. So it's a marker for testing your ovarian reserve.
So let's say I am a 30-year-old female. I have finished my master's, I'm doing my software engineering, and I want to grow in my career. I have not found the right partner yet. But at the same time, I'm reading about, getting pregnant after 30, 35. There's increased risk of complications. I don't want to do it. Based on this discussion, maybe it is time to consider your oocyte egg freezing. How do they do it?
So most important is, I would say, please go to a gynecologist, talk about your concerns with a gynecologist. Now, the gynecologist, based on your history, your family history, your own medical history, will advise you all the tests to find out, what is your overall medical condition. Supposing you're a diabetic, supposing you're obese, supposing you better control all these things before you start to become pregnant. So, first of all, pay a visit to a doctor and get yourself thoroughly examined and investigated. So nowadays we have we spoke about a test called AMH. It's called anti-Mullerian hormone. So it's a very easy way to find out your ovarian reserve. Of course, there are other tests also, like we can do a FSH on day 2 of the cycle. We can do an ultrasound on 3rd day of the cycle to find out what is known as the AFC, antral follicle count. So it's the budding follicles in an ovary. We can actually measure them on the ultrasound to see how much of egg reserve do you have. Now, supposing if you have good reserve.
Is there a number to it?
Yeah. So generally, on an average, we see about 7 to 8 good antral follicles each side ovary per cycle. Right? But PCOS, this number could go up to 15, 20, 25.
But nothing will work.
But none of these follicles are good enough to finally develop into a dominant follicle and finally ovulate. So this is what is PCOS. So number 1 is meet a doctor, get these basic tests done. And in case you feel that the pregnancy is quite a time away, then do discuss with your doctor the option of egg freezing. So egg freezing nowadays with the modern ART, coming in, it's a very simple thing. We give certain medicines to stimulate the ovary so that we have multiple eggs which are developing in a cycle. And then when the time comes, when these eggs are mature, there's a very small procedure by which we aspirate these eggs and immediately they are frozen. It's as simple as
through the vagina uterus.
Yes. So through the vagina, through the ultrasound guided, we just aspirate those eggs and we freeze them. It's as simple as that. Now,
how many eggs do you freeze?
Yeah. So that's another thing. Now, it again depends upon your ovarian reserve. In one cycle, we might just get 15 eggs or maybe just good 5 or 6 eggs. On an average, most of the IVF specialists, they agree on this, that we should have at least 10 to 15 eggs, good quality eggs with us, so that we can have some decent carry home baby rate. So there is something called as the pregnancy rate, then there is carry home baby rate. So we should have at least 15 eggs in our kitty to freeze. Now, some women may require 1 cycle or 2 cycle or 3 cycles of stimulation to get us that number. So nowadays we have another thing which is coming up, which is called embryo freezing. So what happens there is, in case a woman is already married or she is in a committed relationship, then she knows for sure that this is the partner, final partner. We can take the egg from the mother, the sperm from the father, we fertilize them in the laboratory, and when the embryo is made, we freeze the embryo. And we can get 2 or 3 embryos frozen. So embryo freezing always gives us better pregnancy rates as compared to egg freezing, because many of the eggs which we have frozen may not finally end up fertilizing. So in case you are sure, but all these things,
what is the probability success of oocyte developing into an embryo? Frozen egg converting into an embryo when at the time of the need, let's say
it's very difficult.
Like 40-50%?
I would say, yeah.
50%.
This is the
But definitely not
average
100%.
Not 100%,
not 100%.
because it all depends also upon the quality of the egg and also the quality of the sperm later on.
Nobody talks
So-
about that.
Yeah, nobody talks about that.
Got it.